Losing one veteran to suicide is too many. The James E. Van Zandt VA Medical Center Suicide Prevention Team is working tirelessly to provide help and resources to families and veterans to make sure everyone knows help is available. Kate Gavin is the Suicide Prevention Coordinator. Welcome, Kate. It's good to have you here.
Thank you so much for having me.
I think you said 7 years?
Yes.
7 years you've been doing this kind of work.
Absolutely, yep.
It's very important work. What about telling us what the James E. Van Zandt Altoona VAMC is doing to get the word out about suicide prevention?
Yes, so the suicide prevention program, actually James E. Van Zandt, we have a program, and across the nation, there's always a suicide prevention team in each one of the VAs, because that's how important it is to make sure that we're addressing, addressing this topic specifically. Yeah. So our team works throughout the calendar year in doing different outreach events. So we're really partnering with our community members and doing things like going to different events, setting up tables to really communicate the different things a VA has to offer our veterans, and how do you assist a veteran when they're in crisis. We are participating in the suicide prevention task forces that our communities have. We cover 14 counties. So it's a very broad area. So we're making sure that we're in the community and working with our community partners to make sure our veterans know the resources that are available if they're in a time of need.
And the suicide prevention gatekeeper training, tell us a little about that.
Yes, so one of the things that we want to provide to our veterans, but also our community members, so their family, their friends, everybody knows a veteran, right? Mm-hmm. So we want to provide a gatekeeper training. It's called VA Save, and that training is for really anybody. It's going to assist them in being able to recognize the risk and warning signs, what are some of the protective factors, and really how do we help a veteran when they're in crisis? Because all of us can be part of the solution and really play a part in assisting a veteran whenever they're struggling in any way.
And this is not an easy topic by any means, but what can we do to help?
And going back to what I said previously, we really all can be part of the solution. I think we could say that we know that mental health there's a lot of stigma surrounding it, right? And our veteran population, they have a hard time asking for help at times. So if you're seeing any risk and warning signs, maybe increased isolation, maybe they're communicating and they're saying they're hopeless and feeling helpless, or increased anger, agitation, anxiety, really anything like that, it's important just to have the conversation, to sit down across from them and say, how are you doing? How have you been feeling lately? To give them the opportunity to hopefully disclose if they are struggling.
Yeah, because generally speaking, they're not going to bring it up on their own, has been my experience.
Yeah, absolutely.
It's a really tough subject to have. So veterans who are experiencing suicidal thoughts, let's talk about some of the resources that you have available.
Absolutely. So one of the things I really want to highlight is that there is a Veterans Crisis Line. So that is a suicide prevention hotline that is available 24/7. And the number for that is 988-PRESS-1. So a veteran could call and talk to a trained professional to really meet them where they're at, see what's going on, and help them in any way. The veteran doesn't have to be suicidal to use that hotline. And it's really important to communicate that, because you might have increased anxiety, maybe increased depression, and you feel comfortable just reaching out to that hotline. Also, at James E. Van Zandt Medical Center, we have an urgent care center that's open 24/7, so our veterans can walk in. We also have same-day mental health access. So at our community-based outpatient clinics, our veteran can walk in and they can receive mental health care. So there's a lot of different options for our veterans, whether they want to call that national hotline or present to the VA. We can make sure we take care of them.
And the national hotline is absolutely free, I'm guessing.
Absolutely, and they're going to be trained professionals to work directly with those veterans.
And it's available 24/7. I cannot stress enough how much I want our veterans to reach out and make that call.
Absolutely.
Because we appreciate your service and we want you to stay with us. And I want to thank you so much for the amazing work that you're doing for our veterans.
Thank you.
It's impactful and it's powerful.
Thank you so much.
This has been an amazing experience. Thank you so much for joining us today. We appreciate you. And if you're a veteran, please just reach out. We'll see you again soon.